Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now in this episode, I'd like to briefly cover two of the CDC's 11 symptoms of the coronavirus, those being runny nose and sore throat. Now I've had patients come into my office because of a persistent runny nose and sore throat. Again, if you've not been tested for COVID-19, I usually recommend you do so. Now, if you're experiencing any of the CDC's 11 symptoms of coronavirus, whether you've tested negative or positive, please seek advice from your physician as well as your local acupuncturist. Now, when it comes to sore throat, research shows this symptom is not a very common one for those infected by COVID-19. Of the patients in which I've seen that have been infected with this virus, I would say roughly 10% presented with sore throat as a symptom. Now, sore throat is not a symptom that indicates a specific disease. Sore throat generally feels the same whether you've had the cold, flu, strep throat, or even COVID-19. Please understand that sore throat can also be caused by a bacterial infection and other inflammatory conditions such as postnasal drip, allergies, and so forth. So experiencing sore throat as your main symptom should not be cause for panic. If your sore throat is accompanied with a headache, fever, cough, I would still say to not panic, but go and get yourself tested. Although sore throat can be a potential symptom of the coronavirus, it is seen as less common when compared to symptoms such as fever, cough, and fatigue. So another question I've been faced with over the past few weeks was, is my persistent runny nose a symptom of the coronavirus? My answer to that is not necessarily. Runny nose can be due to allergies, a simple cold. Again, get tested if this symptom is accompanied with other symptoms of COVID-19. I get calls asking if acupuncture can help with these two symptoms, and of course I tell them yes. Both symptoms in Chinese medicine are generally the result of having acquired an exterior pathogenic factor. When it comes to Chinese medicine, runny nose can be associated with both wind cold and wind heat as an exterior pathogenic factor. Now, sore throat in Chinese medicine is associated with wind heat. As I've stated in several mini coronavirus symptom episodes, wind tends to be more prevalent of the 6 exterior pathogens in Chinese medicine to be responsible for the CDC's 11 symptoms of this virus. Now, wind is a seasonal pathogenic factor which tends to present throughout the year. This pathogen tends to adjust in accordance with the season for which we're constantly exposed, whereas the moment our body's protective chi becomes deficient, a wind pathogen can invade the body. The more common combinations of this pathogen are wind cold, wind heat, and wind dampness. When treating patients with symptoms such as sore throat, runny nose, I, as a licensed board-certified doctor of acupuncture, would focus on releasing the exterior as well as nourishing the body's chi. If it's a case of wind cold, I would use acrid and warming herbs to cause sweating. In the case of wind heat, I would use acrid and cooling herbs to clear and release the exterior. I've had patients come into my office recently complaining of having an aversion to cold, fever, no sweating, headache, and body aches, whereas their symptoms would present as having a cough with clear nasal discharge. Their tongue would have a thin white coating. These are the symptoms of exterior wind cold in Chinese medicine, whereas I would focus on releasing the exterior pathogenic factor. I've also had patients who contracted this virus and have come to my office with a slight fever and feeling an aversion to wind. Their symptoms would present as having a yellow nasal discharge, a sore throat, and a cough with yellow, thick, sticky sputum. The tongue would present with a red tip, and there would be a yellow coating to it as well. Now, these symptoms are that of an exterior wind heat pattern, whereas again, I would focus on releasing the exterior. There are ways in which I as an acupuncturist could approach, or rather these are ways in which I would approach treating runny nose and sore throat. But in my next episode, I will discuss my approach to treating patients who'd experience a loss of taste and smell as a result of becoming infected with this virus. Now, treating those symptoms were pretty interesting, to say the least. But in the meantime, don't forget to subscribe to this channel. And until next time, acupuncture is my life. What's yours?